But why, with all the suffering in Barbados, and you know that we speak of health and education, that in 2 budgets, not the Minister of Finance, the Prime Minister, or the Minister with responsibility for health, can find a minute to speak to that institution. And it is clear, because the government faces a very embarrassing situation with respect to healthcare in this country, and the Queen Elizabeth Hospital in particular. They made numerous promises to you. They would put in place immediately, being elected to office, a rescue the QEH plan. 3.5 years later, where is this plan? Nothing has changed at the Queen Elizabeth Hospital, and indeed, many of you would attest that things have indeed deteriorated in many departments. What is happening? And I understand why the government is not speaking about the hospital. Because a number of projects are planned for the hospital. Mr. Brockett, I see you in the back. The Emergency Ambulance Service Headquarters, the new one, not the temporary one, was supposed to commence on the 1st of October 2009. It was supposed to have been completed by the 30th of May 2011. The projected cost is $3 million. The status at this point in time is that the work has not commenced. The temporary ambulance relocation, this commenced in July last year, was supposed to be completed on April the 1st this year. Mr. Brockett, is it complete? Supposed to be completed 1st of April, still in progress. A new central storage, and all of these are projects for this Queen Elizabeth Hospital. I assume part of the rescue the QEH plan. Central storage to start the 12th of April 2010, to be completed on the 30th of September 2011. Status on hold. The upgrade of the Accident and Emergency Department was supposed to have commenced the 29th of December 2009, was to be completed the 16th of August last week, on hold. The cardiac suite, supposed to have started the 4th of January 2010, was supposed to be completed on the 24th of May this year, on hold. The air conditioning upgrade of the Lionside Care Center, this is not on hold. This is the one where the air conditioning units were previously purchased, and those have subsequently been sold in the crates, wrapped up brand new, and they are now embarking on a new tendering process to acquire new air conditioning equipment. And I think most of you understand that that is about commissions for people. The election is coming up. So you have a list of about 9 capital projects within the hospital. And one of them, the preparation of a temporary facility for the ambulance service, is the only one that is being done. And that was supposed to be completed on April the 1st this year. And it is from the QEH recapitalization status report summary table. This is their words. This is the QEH speaking about itself. That is why no one can say a word about the hospital. But the minister needs to tell people also, because the government, the DLP made a lot of weather about cost overruns. There is an electrical upgrade of the QEH, which is in progress. I don't know if the person who was awarded the company was number 1, 2, 3, 4, or indeed number 5, based on the tendering process and the recommendations of the tendering committee. I don't know. But the point is that this was supposed to cost about $8.5 million and was to have been completed last year. As I speak to you, it might be completed next year. In March, as part of the estimates, the government requested an additional $5.5 million, bringing the cost up to $14 million. It is now at over $18 million and has not been completed. And they had the temerity to tell you about transparency and cost overruns. Let them speak about this, what is going on in the hospital.